Picture this: an eerily quiet hospital corridor, occasionally punctuated by the distant beeping of machines and the soft shuffle of a nurse's shoes. The dimly lit walls hold stories of countless battles fought against the unpredictable tides of health and disease. Here, in the heart of the hospital, the night call duty unfolds, a solitary vigil in the ocean of medical mysteries. Every night call has its own rhythm, a unique symphony composed of the quiet hum of the hospital machinery, the occasional rustle of paperwork, and the intermittent whispers of the medical staff. Tonight, the symphony is calm, almost serene, the silence only broken by the abrupt, jarring ring of the phone. It's a sound that sends a surge of adrenaline through your veins, a clarion call that signals the start of a new medical mystery. The voice on the other end of the line is hurried, relaying information about a patient with syncope, a condition characterized by a sudden, brief loss of consciousness. Your heart pounds in your chest as you listen, the medical detective in you awakening to the challenge. The hospital, once a quiet sanctuary, now transforms into a theater of clinical intrigue. Each case of syncope is a riddle waiting to be unraveled. Is it a simple fainting spell, or a symptom of a deeper, more complex medical condition? The answer lies hidden within the patient's history, their symptoms, and the myriad of tests that you'll soon order. As you hang up the phone, you feel the thrill of anticipation. The game is afoot. The night, which initially promised a monotony of routine checks and paperwork, now holds the promise of a thrilling chase after the elusive truth. As you step into the fray, armed with your knowledge and experience, you feel a sense of purpose. The night call, once a daunting responsibility, has now become an opportunity to learn, to grow, and to solve a medical mystery that could change a patient's life. And so, the night that promised monotony suddenly transformed into a thrilling medical puzzle. A middle-aged man, a sudden collapse, a worried family. The stage was set for a medical enigma. This was no ordinary fainting spell. Our patient, a seemingly healthy man in his 40s, had experienced a sudden and unexplained loss of consciousness, an event medically known as syncope. And like a detective on the trail of an elusive suspect, I was tasked with piecing together the clues to uncover the cause behind this mysterious event. Syncope, in its simplest terms, is a temporary loss of consciousness, usually related to insufficient blood flow to the brain. It's a symptom, not a disease in and of itself, and can be triggered by a multitude of factors. It's like the body's circuit breaker, tripping when something isn't quite right. There are many different types of syncope, each with its own set of potential triggers. Vasovagal syncope, the most common type, can occur when your body overreacts to certain triggers, like the sight of blood or extreme emotional distress. Then there's situational syncope, which can happen during or after urination, swallowing, or coughing. And let's not forget about cardiac syncope, which is caused by an underlying heart disease and is generally the most concerning type. In our patient's case, there were no obvious triggers. No sight of blood, no extreme emotional distress, no recent urination, swallowing, or coughing. So, we had to dig deeper. The potential causes were vast, ranging from heart conditions to neurological disorders, from dehydration to certain medications. The challenge was distinguishing between the benign and the sinister, the harmless faint from the life-threatening collapse. This was not a simple task. Syncope, with its many faces and causes, is a medical chameleon, blending into the background of a patient's overall health landscape, often hiding more serious underlying conditions. With an array of possibilities, the challenge was to find the exact cause. And so, the detective work began. With the patient stable, the detective work began, every clue critical. In the world of medicine, diagnosis is often akin to detective work. The mystery in question was syncope, a sudden, temporary loss of consciousness often related to inadequate blood flow to the brain. Now, to crack the case, we had to follow the breadcrumbs, with each step taking us deeper into the labyrinth of symptoms, signs, and potential diagnoses. A detailed patient history is always the first step. Like the opening pages of a detective novel, it sets the stage, introducing the characters and their circumstances. We asked about previous episodes, their frequency and duration, and whether there were any triggers. We inquired about any accompanying symptoms like palpitations, chest pain, or shortness of breath. Family history was also crucial, as it could hint at inherited conditions. Moving on, a thorough physical examination was next on the agenda. This is where we, as medical detectives, use our senses and tools to gather more clues. We observed the patient's general condition, assessed the vital signs, listened to the heart and lungs, and looked for any external signs that might give away the underlying cause. But the detective work didn't stop there. Various diagnostic tests came into play, each one like a magnifying glass, bringing the finer details into focus. An electrocardiogram, or EKG, was performed to evaluate the heart's electrical activity. Blood tests were ordered to rule out metabolic causes. In some cases, a tilt table test, a carotid sinus massage, or an echocardiogram might also be performed, depending on the clues gathered so far. In this intricate dance of diagnosis, every step was measured, every move calculated. Each piece of information was a potential key to unlock the mystery, to illuminate the path towards the truth. A doctor, much like a detective, relies on this process of elimination, of following the evidence, of piecing together the puzzle. Every piece of information was a step closer to solving the puzzle. As the night wore on, the pieces of the puzzle started to fall into place. It was like a game of chess, where each move was methodical, each test result a pawn advancing forward. The blood work came back first, revealing an electrolyte imbalance that could certainly contribute to the fainting spells. Next, the EKG results displayed a few irregularities, but nothing that could definitively point towards syncope. However, it was a noteworthy clue. The patient's history, though, proved to be the knight on this chessboard. Anecdotes of similar fainting episodes in the past, a family history of heart conditions, and the patient's own admission of feeling dizzy before each episode all pointed in the same direction. Like a detective, a doctor must use critical thinking and problem-solving skills to decipher the myriad of clues presented. It's not always about the most advanced technology or the rarest of diseases. Sometimes it's about connecting the dots, understanding the story that the patient's symptoms, history, and test results are trying to tell. We also had to consider the timing. The patient reported these episodes happening mostly at night. This pattern suggested a possible link to circadian rhythms and sleep cycles, another piece of the puzzle that needed to be factored into our diagnosis. But the path to diagnosis was not a straight one. It was filled with twists and turns, mirroring the complexity of the human body itself. Each piece of information, each result, each symptom, they all held weight. They all mattered. And they all brought us one step closer to answering the pressing question: why was this patient fainting? The importance of critical thinking in medicine cannot be overstated. It's the lifeline that guides us through the fog of uncertainty, helping us navigate the complex labyrinth of the human body. It allows us to piece together the puzzle, to see the larger picture, and ultimately, to provide the best care possible for our patients. The puzzle was nearly complete, but the final piece was yet to be placed. With the dawn peeking over the horizon, the final piece of the puzzle fell into place. After a night of careful detective work, the cause of the patient's fainting spells, also known as syncope, was finally uncovered. The culprit, an irregular heartbeat or arrhythmia, was causing insufficient blood flow to the brain, leading to these sudden episodes of unconsciousness. Arrhythmia can often be an elusive diagnosis, hiding in the shadows, only to reveal itself in moments of stress or exertion. It's like a stealthy cat, slinking around unnoticed until it pounces. But once it's identified, it's a relief. Suddenly, the fear of the unknown is replaced with a clear path forward, a roadmap to recovery. The treatment plan for this patient involved a two-pronged approach. First, medication was prescribed to regulate the heart's rhythm, ensuring a steady, reliable beat that would keep the blood flowing and reduce the risk of future syncope episodes. This isn't a one-size-fits-all solution, though. Each patient's medication regimen is tailored to their specific needs, taking into account their overall health, lifestyle, and other factors. The second part of the treatment plan involved lifestyle changes. The patient was encouraged to maintain a healthy diet, rich in fruits, vegetables, and lean proteins, and to engage in regular exercise, albeit with caution. Avoiding triggers such as stress and excessive alcohol was also recommended. This journey from uncertainty to diagnosis wasn't an easy one. It involved careful examination, thoughtful questioning, and a lot of patience. But it's a journey that's worth it. Because now, instead of living in fear of the next fainting spell, the patient can focus on recovery, on regaining control of his life. And that's the beauty of medicine. It's not just about treating symptoms. It's about uncovering the root cause, about understanding the why behind the what. It's about giving patients the tools they need to take charge of their health, to reclaim their life from the grips of illness. As the sun rose, the night's mystery was solved, and the patient was on his way to recovery. In the quiet calm of the morning, there was time for reflection. As the adrenaline of the night call waned, I found a moment of peace to gather my thoughts and contemplate the events of the past few hours. Every night call is a reminder of the unpredictable nature of medicine. You never know what case might come through those hospital doors, and each one is an opportunity to learn, to grow, and to better oneself as a medical professional. The fainting spell that had us baffled was a testament to this. A medical mystery that unraveled before our eyes, revealing a case of syncope that required our immediate attention and action. Staying calm under pressure is one of the most important lessons that one can learn from night calls. It's not just about handling the medical aspects of the situation, but also about managing one's own emotional response. It's about maintaining a clear head, making rational decisions, and acting swiftly and decisively. It's a skill that is honed over time, through experience and practice. And it's a skill that can make all the difference when a patient's life hangs in the balance. The satisfaction of solving a medical mystery is hard to put into words. It's a feeling of accomplishment, of relief, and of pride. It's the knowledge that you've made a difference, that you've helped someone in need, and that you've contributed to the vast body of medical knowledge. It's a feeling that fuels the passion for medicine and drives us to strive for excellence. But perhaps the most valuable lesson from the night call is the importance of continuous learning. Medicine is a field that is constantly evolving, with new research, new treatments, and new challenges emerging every day. As medical professionals, we must constantly strive to keep up, to learn, and to adapt. Because every patient and every case is unique, and it's our duty to provide the best care possible. And so, another night call ended, leaving behind a wealth of experience and the anticipation of the next challenge. To sum it all up, syncope, a sudden, temporary loss of consciousness, led us on a fascinating medical journey. This tale began on an ordinary night during a routine night call. However, the night rapidly shifted gears when we were presented with a case of a patient experiencing recurring fainting spells. This was no ordinary case of fainting. It was a case of syncope, a condition that can be as bewildering as it is concerning. The patient's symptoms were puzzling, their condition perplexing. But as medical professionals, we had a responsibility to unravel the mystery and provide the treatment needed. The detective work began in earnest. We embarked on a quest to gather clues, starting with the patient's medical history, then moving on to physical examination, and finally, a series of diagnostic tests. The clues were scattered, and piecing them together required patience, diligence, and expertise. As the pieces of the puzzle fell into place, the diagnosis of syncope became clear. The fainting spells were not just random occurrences, but rather symptoms of an underlying condition. With the diagnosis confirmed, the next step was treatment. The treatment plan was tailored to the patient's unique needs, focusing on managing the symptoms and addressing the root cause of the condition. The importance of understanding syncope in medical practice cannot be overstated. It's a condition that can be easily overlooked or misdiagnosed due to its varying presentations. But with a vigilant eye and a comprehensive approach, it's possible to diagnose and treat effectively. This case of syncope was not just a medical challenge, but also a learning experience. It underscored the importance of critical thinking, thorough examination, and patient-centered care in the realm of medicine. Every case is an opportunity to learn something new, to hone our skills, and to make a difference in the lives of our patients. Every night call is a new adventure, a new challenge, and a new opportunity to learn, just like the unforgettable syncope case from that fateful night.